Good evening. It is 6:01 on July 12th. This is a special meeting for the Public Safety and General Government Committee. I would like to call it to order by calling roll call. Heidi Alterman, Nicole Ayers,
Here.
Josh Goldstein,
Here.
Dominique Johnson,
Here.
Brian Meek. I know you're here. Diana Revolus. Oh, wait, we have a quorum for tonight's meeting. Is there anybody here for public participation? I don't believe
It doesn't look like there is
it
anyone.
doesn't. And I just want to make note for the record that at 6:02, Councilmember Revolus has joined us.
Thank you.
Thank you. All right, so because this is a special meeting, we are not going to approve the minutes of the general meeting from last month. We'll do that at the next general meeting, but we'll move on to new business. So I'm going to move for the police department 1A and 1B together, and then we'll open it up for discussion. So I'm going to read it and then I'll ask for a motion. 1A is authorize the mayor, Harry W. Rilling, to execute any and all agreements, documents, instruments, and or amendments as may be necessary to enter into agreement with Recovery Network of Programs, Inc., for the sole source contracting for embedded social workers amount not to exceed $216,000 annually, ARPA funds account TBD. And 1B, authorize the chief of police, Thomas Kowalik, to execute any and all agreements, documents, instruments, and amendments as may be necessary to implement the Recovery Network of Programs Community Response Initiative within the city of Norwalk. Can I have a motion to move this forward, please? Councilmember Goldstein, thank you very much. So we also have Lamont Daniels with us tonight, in addition to our police chiefs. I just want to say one thing before I turn it over to you all. This is something that I have been trying to work on ever since my first meeting with the chiefs of police. And it was something that they had talked about and had great success in Stamford over the last year or so. And I just thought what a great thing that we could bring to our community and our police department. And I'm just really, really excited about the opportunity to make this actually come to fruition. So I'd love to hand it over to Chief Kowalik and Chief Daniels, if you guys would like to speak to this, and then we can open it up for discussion, of course.
Yeah, thanks. I appreciate it. Let me just give you a little history, just real quick. I won't take up a lot of time because I know you're pressed for time, but so as you know, there was a lot of discussion over the past year and a half, 2 years over the issues with police responding to mental health calls and the negative impacts that have occurred sometimes with those calls. So around the country, many departments were looking at other options and other solutions to that issue by getting social workers or other folks to respond either with the police or instead of the police or after the police to deal with some individuals who had ongoing issues that weren't being properly dealt with the system that's currently in place. So we looked at a variety of programs within our police department to see what we could do. We came up with a couple suggestions, and then Deputy Chief Walsh was contacted Stamford Police and saw that they had a program that they started there with partnering with the Recovery Network, where they had an embedded social worker come in and they contracted with the Recovery Network, and they had great success with dealing with individuals with substance abuse, with mental health issues, a variety of issues. And a lot of these people, as we know, are frequent callers or frequent guests of the police, so to speak. And, we have trouble dealing with them. And unfortunately, the services just aren't there for these people. And Stamford had great success with their program. So we brought their program to the city, and we learned that the city was also looking at doing something globally, partnering with other agencies to try to do something. So we had a few meetings with Lamont and some others to try to see what options were out there. And we basically ended up settling on Recovery Network was the best choice for us and the quickest that we can put into place. Then funding became the issue. And in speaking with the mayor and the chief of staff, they then determined that ARPA funds would be appropriate to use to fund this for a one-year pilot project, which is what Stanford has done, a pilot. And that's what you see on your agenda today, is to approve contracting with Recovery Network. And what they will do is embed a social worker in our department. They'll have an office inside the police department. They'll have access to our reports, our files, our officers to be able to discuss ongoing cases. I personally have probably 4 or 5 individuals who regularly contact me over their, that they don't realize are mental health issues, but they are. And they haven't received a proper service that I wish they could get. And I think with an embedded social worker, we're going to solve a lot of these issues that Stanford has seen. So I think it's an exciting time. It's an exciting program to bring to the city. I think it's a benefit not only for the community, but for the police. Because I know it's frustrating for officers who have some training, but they're responding to some individuals time and time again, and really can't offer them really much services other than quelling a particular issue at the time. So what we were required to do is not only go before Health and Public Safety for approval of this authorization, but on Thursday, we're in front of the Finance and Claims Committee for the use of the ARPA funds to also fund the program. And then once, hopefully, that's both approved, then your following Common Council meeting will have this on the agenda, and then we can have the law department finalize the contract. The law department has the contract, it's really more of an agreement than a contract, but they have that now to review because I wanted to get this thing going. So hopefully, once the approvals are in place, we can immediately have Recovery start recruiting a social worker. Stanford is fortunate. They recruited a tremendous social worker who's bilingual, who has experience dealing with the court system, dealing with DCF, dealing with other state agencies. And I'm got my fingers crossed that they'll find somebody for us that'll be just as qualified and seamless transition and work with us in the department. We've identified office space already. And so we're ready to go once we can get this going. So I'm excited about it.
I'm glad to hear you guys are being so proactive about the office space and having the contract or the agreement sent to legal already. It sounds like we'll be able to hit the ground running as soon as this is signed off on. So Chief Daniels, do you want to speak to this?
Thank you. And again, thank you, Chief Kahalik. I'm really here in a supportive role. As a social worker myself, it just excites me that we are now at this, in my mind, it's a game changer. I mean, the research is clear around this model can make an impact in communities. So in a supportive role, I've had extensive conversations both with Chief and the team, but also speaking specifically with the Recovery Network team. And really speaking from the sole source perspective, we did our own due diligence, and again, moving for your support around sole source, that they really have risen to the occasion to really be that expert locally and in our state. They know our community. They know they're working with similar municipalities, meaning Recovery Network across the state. They have the expertise. And I think the point I want to highlight that Chief mentioned is that while we will look at still the service providers in the community, because that is the initial, what's the word I'm looking for? That is the referral process. However, but what makes this exciting is that the Recovery Network brings a wealth and breadth of resources because they are a regional organization. So when they come in contact with a referral that they may have outreach to the department, that they will look internally, what do we have in the city? But if that service is not available, our residents now will have direct access and preference to their wide network of services. And I think that's the key. We want to make sure that if the services does not exist locally, we want to partner with an entity that can connect families or residents, particularly with these services. So then in my conversation with Recovery Network, I said, well, if the service doesn't exist, transportation could be a barrier. They are prepared to, with this contract, to ensure that transportation is not a barrier, The extensive wait list that we all know so well in the mental health community is not a wait list. Again, this contract will certainly provide some comprehensive, not only support, but service away through the Recovery Network system that now Norwalkers will have access to that they would not have normally. So again, I'm just excited to support the chief and the team in my role, helping to move this through. And we're just excited to partner. As you all know, the Community Services Department, we want to partner with this individual. So the services that do exist in Norwalk, we want to make sure we connect that resident to services. But again, beyond what we provide, making sure they're served. Thank you, Chair.
Thank you so much. Just one housekeeping thing. Can IT have Nicole Ayers moved over to panelist? She's an attendee right now, and she should be a panelist. Councilmember Revolus.
First, forgive me for being off camera. I already told you it's a little bit crazy today, so I appreciate you. Secondly, happy about this because this was conversations from prior to, but something that was just said, I have a question on, and a few questions that probably will come up to you later. First, we have more than about 2 languages in this community. How are we allocating things like the language line where all municipalities should have to help support this counselor if you have things further than like the Spanish speaking community to need help? That's my first question. Second question, I know when you come to us at the finance committee that council member who's already said this, but you will bring this up. How will we fund this after ARPA funds? Council member Greg Burnett will ask you that. And my last question is this, in talking to the health department, we already know that we've had a problem with minimizing beds for mental health situation in our hospitals. How is that being addressed with this as well?
If I could jump in, I mean, these are larger issues, Councilwoman, so I don't want to come across as that this is an answer, but can you hear me? But this is another tool. This is another tool to serve our residents. This is another tool that presently does not exist in the city of Norwalk. And so that's how we're looking at it. As Chief mentioned, this is a pilot program. And I can speak to a little bit, Chief, but definitely don't want to steal your thunder. This is a pilot program. So that is the question that, to your point that Councilman Burnett raises, how we're going to fund it. That's a question and a conversation we'll need to continue. I think the other piece that I was really excited to talk with Jennifer, who's the CEO, they will be tracking data, metrics, the impact. So it's not just saying we want money, we want to do this, the data will inform us. Was it effective? Is it effective? Are we making a difference? How are residents being served? If in fact through the Recovery Network system, are Norwalks receiving the treatment that they need? But again, this is a pilot, and the pilot, answers those questions. So in a year's time, we can then come back to really dig deep in what the data is telling us. And then, the goal is to think about, if it's effective and we see a difference in making an impact, we do need to look at how do we sustain this program like any other program we would do under a pilot type of model.
So that was literally maybe half of one of the questions that I asked of the 3 that answered. So I guess I appreciate that. But again, with your pilot, how do the 3 support it? Meaning, okay, it's probably with the funding, with the ARPA, whatever. But the languages, we have more than 2 languages in this community. We have the service of the language line. How are we having them at the table or in additional supports? Because all municipality services in Norwalk have the accessibility to it to support this counselor. And secondly, if these people have to be transported to a bed and you talk to the health department, has that had a part in this pilot program and conversations? And I personally believe, I guess, again, with what you just said, fine, but that still should be a topic right off the bat from the beginning. So
yeah, these are ongoing conversations.
If Chief doesn't mind maybe answering my questions, I would appreciate it.
Well, as far as language line, we contract with language line. We use them all the time. So
yeah, yep.
So the counselor is going to have the same access that the officers and our dispatchers have.
Okay,
that social worker will be within our department, will be vetted, and will have full access to our systems, to our reports,
okay,
to our officers, to all the services that the officers have. Well, not all, but most of the services that the officers have access to,
okay.
that are allowed by law. So they'll have
Mhm,
full resources to be able to get. It's obvious that we can't expect to get a social worker that, can speak every language that's within the city. We have so many. So, we need to
mhm,
look at other resources. We have officers that also speak a variety of languages that can help when possible too. So, we do
mhm.
that now and we'll continue to do that. Um, and I don't know I think Lamont pretty much
S-
covered the other one, but I'm
And
not sure.
the talk with and last, and I'll let the thunder go with somebody else. Just lastly, just thinking about um, how we were how in the health sector that you guys spoke to them. Did you have any discussions on if these people, if let's say a client, for lack of better words, somebody that you're working with needs a bed. We had a problem in structures of that we were losing beds when it comes to mental health and how it was being transferred to other sections outside of Norwalk. Has that been a conversation with you guys at all?
I have not had that conversation, but I do know in speaking to Stanford that it has not been an issue and that
Okay.
they're very happy with recovery and the services they provided. I wouldn't say they're happy. They're ecstatic with the services that recovery has provided. And they had no negative comments at all. It was all positives. It's far exceeded their expectations of what this program would do for their city. So um, I'm
Okay.
hopeful that we'll see the same results here in 6 months and then a year later, and we'll be more than happy to really push to make this a long-term program here. But again, time will tell, and as Lamont said, that's why it's a pilot program, and they're going to provide us with extensive information, which they have in the packet. There's a lot of information from Stanford that's provided as to the numbers and the effect that they've had and the number of individuals that they've served in a very short period of time. So I think we're going to be more than happy.
Okay.
Um,
Thank you.
Councilmember Revelous, do you have anything else to add?
Um, no, I think it's just three of the things that maybe might be like a checkpoint in adding wireless pilots, but I am happy to see this because this has been a conversation for quite some time. And that's really it. I appreciate it. Thank you very much.
Thank you. Councilmember Ayers. You're on mute, hun.
And I pushed the button. I'm sorry. I just want to say kudos to the team for bringing this to our city. My question is more on a public or PR perspective. How are we educating our constituents and letting the people know that we are having, I guess we're calling it a pilot program, or we're adding this staff member to the overall police department? I think this information is beneficial because not only the people that are directly calling maybe 911 or the non-emergency number, but people that may have family members or residents of these people that may be calling and stuff. So how are we getting this information out to the community so they know that this is an additional service of the Norwalk Police Department?
Well, so far we have not, because it's not in place and we don't want to, get ahead of ourselves. But once it's approved, and hopefully it's going to be approved at the next council meeting, which I guess is in another 2 weeks or week and a half or whatever. Once that happens, then it's just a question of getting the contract approved through the law department, which I don't see a problem with. I'm sure that will go forward. But we'll, between working with our social media, the city PIO, Lamont's office, there's a lot of resources that we have that have good contact with the community that can get the information and the word out. And I know recovery themselves will get the word out. So I don't foresee that as being a problem. I think that's going to be something that we'll be happy to promote, and everybody in the city will be promoting it as much as they possibly can.
We will
Yes, Chief.
certainly all be promoting it as well. I will ask that of all of you.
Chief,
Go
I
ahead.
didn't see it as a problem. I just think that I wanted to bring it to this platform so that we just have that in the front of our mind. So many times certain pockets of our community have a negative viewpoint of the police. This is a perfect opportunity for us to give a more positive viewpoint of the police. And so that is why I'm bringing it to your attention. And I know that the city, as well as your department and other departments, have a very rigorous social media presence in the communication. But I just think any opportunity that we have to shift people's perspective of any city department to a more positive perspective, we should be forward thinking. Thank you, Chief.
Thanks. And the other aspect of this is it's also a very proactive program. So we're not always waiting for somebody to contact us. It's going to be where people call the police for an issue and then we're able to respond, but we'll also be able to respond with the social worker. So we'll be able to direct people out of the criminal justice system, out of the police aspect and into what they really need, which is services. So I think that's going to be the real positive, and word will spread that way too, that it's okay to call because you're going to get the help you need. We're going to find the right person with the right skill set that's going to deal with it in the right manner.
And not to steal thunder, but Chief Daniels, you and I had spoken about doing a big, release too, or announcement once it's official.
That is correct. So Michelle Woods Matthews, as you all know, we've already been in contact. So she's just monitoring the process, and we definitely want to do something big to really, and the mayor wants to do something, a big press announcement and really hold an event around, because we really do see it as a game changer, as another tool to support our residents.
Councilmember Goldstein.
Thank you.
Yeah, I want to underscore, and I think this sort of, contributes a little to what Diana was saying, but this is a big deal. I mean, this is when we talk about, coming up with innovative solutions to, satisfying a lot of issues that the police department faces. Like, this is it. Like, this is a big one. I think Jen may have mentioned this a little while ago, and I think I got distracted for a second. Thanks for lowering the hand. In terms of just next steps here, once council approves and the money is, essentially authorized by council, how long is it going to take for someone to be embedded, assigned? I don't exactly know what the verbiage is, but just so people have an idea of how quickly this service will be available.
Well, I know recovery, I believe, is already kind of looking for the right person, even though it's not official. They can't really do too much yet, but they have their feelers out. And from what they discussed, and Lamont can maybe has more information, but I would expect it to be 3 months to 6 months to recruit, hire. We have to do a background vet because they'll have access to a lot of sensitive information and files. So, and recovery also wants to get the right person. It's not just getting someone that has social worker behind their name. Like I said, the person in Stanford has a lot of experience in the criminal justice system, in the court system, working with DCF, working with domestic violence victims, probation. That's the ideal, is to get somebody who really understands the system and what's available in different aspects of the system and what's not available in different aspects of the system. So I would expect it to be 3 to 6 months to get somebody recruited, there, vetted, and on the ground running. But Lamont may have.
Yeah, you're accurate. I know, talking with Jen, they're doing a soft kind of recruitment, but again, want to wait till official. I think the other piece too, I think it's important that we will be, we're contracting out, Councilman, but I think the other piece is we, the chief, and whoever the chief designates, we will be part of that process. So it's not just them saying, this is the person we have to agree to. So it really is a partnership because we know our community, but certainly they are the experts. So it's a multi kind of layered process. But to Chief's point, 3, of course, I said, could you do it in 2? But that's just me being ambitious. But again, I think once it's official, they're going to do everything they can within their network and resource to try to find that right person. But they're kind of just doing a soft touch, kind of just giving some feelers out around this could possibly be happening. But to Chief's point, 3 to 6 months is probably a reality.
And let me also just ask, thank you. And just one other thing, obviously the ARPA funds will be covering at least the first year. does this come up? Will this request be part of the next budget cycle or the budget cycle after that? Because I'm trying to get the timing down. Basically, this $216,000 request, is that going to be something that comes up early next year, or will it be a year after? I would think it'd be early next year, but I'm just curious.
Yeah, it would have to be based on how early we do our budget for the following year.
Yeah,
We're going to have some data. We're not going to have a lot, but the appropriate thing to do would be to look at this, that it is successful, and to look at budgeting this into the next fiscal year. And then if for some reason the city decided not to do it, it's a lot easier to then not fund it than it is to try to find funds for it.
sure.
So our plan from the police department's point of view is to include this in next year's planning in our regular operating budget as a another contract. And I'm guessing, just based on speaking to different council people and the mayor and other people in the city, there's a lot of support for this. So I'm hopeful that, the funding is not going to become an issue next year. And in the big picture, I know $200,000 is a lot of money. It is a lot of money. But in the city budget, the size that it is, and our police department budget is $24 or $5 million. It's a small piece, but it's so valuable that it's worth
Yeah,
a
I
lot
agree
more
with
than
you,
the
by the way.
$200,000 that we're paying. So this is something that will pay for itself, I think, just in police response, getting people out of the system. We have a lot of people that we respond to regularly. Substance abuse issues, drug, alcohol issues, homelessness, mental health. I mean, it covers so many areas that people are looking for help and need help that we're responding to on a daily basis. And
Oh,
this is
please,
gonna
I'm
be
not
amazing.
asking you to justify. I actually completely agree with the validity of this, and I actually think that this is a worthy investment. I just wanted to give people here, and I think the council, an idea of what they can expect in the coming months. So thank you, Chief.
And
And
Chief,
Chief.
you and I had spoken when we first started talking about this, there might be possible grant money that we can go after to support this in the future. So I'd like to keep those lines of communication open as
Yes,
well.
I believe Stanford has received significant grant funding. There's a big push, statewide regarding mental health issues and these kind of programs. And I think you're going to see more and more of this because there is a big push. In fact, we're now required to report on an annual basis on what we're doing as far as dealing with mental health calls and what our response is, and do we have social workers? What resources do we have as a police department?
Mhm.
So I'm guessing more and more funds are going to be available for this kind of thing, even at the federal level too. So it's very possible that there's going to be grant funds, but we'll look at obviously all aspects in every sense of where we can get funding for this, assuming that it's going to be successful.
Yeah, I don't want to cut anybody off. I see Councilmember Meek is next. I just want to be conscious of time. So I'm going to take Councilmember Meek's question. And then if anybody else has like one last question, let's just try to keep it quick because we also have 2 other action items this evening and we have to get to general counsel. So Councilmember Meek.
Thanks. This all sounds good. And Josh asked my question, and it sounds like Councilman Burnett will be asking about the ongoing. I just remind everybody, this city has gotten into a lot of trouble when it depended on grants for things like headcount as opposed to capital. So it's definitely good questions that need to be brought up and answered. So that just segues into my 2 what I think might be quick questions. Does the contract, 1, offer a renewal option? And 2, is there any option to potentially insource the hires that the vendor finds for us here? Is there like a buyout where we could just bring them in full time and get them off the books and get them off a grant or fund it however? Just wondering if those 2 things might be available in the contract. Thanks.
Yeah, and I'll also defer to Lamont. He may know better. As far as the first question, and I'm sorry, I forgot your first question. Can you give me that again?
So yeah, the first question is there any renewal option, like the years coming up, maybe the vendor.
Yeah,
getting scared
I'll have
about-
to look at that. I believe there is a renewal option on there.
The vendor's getting
Um,
scared about our budget process and sends really good talent off to another town, and we have to start this all over again. So that is the one question. And then a question, in any kind of temporary staffing arrangement to see if we could insource the talent if we like them enough to just keep them on full time. Thanks.
Yeah, that second question, I don't know. But those are two things that we can speak to the law department about when they're negotiating the terms of the agreement, which is, right now, all we have is the model agreement that Stanford used. And that's what Recovery used for the agreement that they sent us to send to our law department. So those are two things that I can mention to Darren at the law department to kind of look at and, massage, if that's something that's important, to the council.
Thank you, Chief. I'm all set. And as you mentioned, I have a hard stop at 7:10 because I'd like to get down to 125. Thank you.
No problem. Councilmember Johnson, this will be the last question on this item.
Thank you, Chair. I'll be very brief. I want to thank you all, join my colleagues, because I know this has been in the works for quite some time, and just want to say thank you to the police department, to the chiefs, to Chief Daniels. Really quickly, Chief Daniels, this may be most appropriate to you, but when these social workers are hired and embedded, I assume part of the Recovery Network of Programs knows our infrastructure of nonprofits okay, you already know my question then. So there'll be interface.
Absolutely.
know.
In fact, I've been talking with the CEO and the program manager who will be our point of contact. So we're actually, again, I'm going to say soft. We're having these soft conversations around understanding the landscape and ecosystem in Norwalk. And they're looking forward to just connect right in once this person is hired, so they really understand the wealth and breadth of resources here, but also recognizing what resources that we will be relying on them when necessary. So we're having those conversations as we speak. Thank you for that question.
Oh, fantastic. Thank you all so much again for this great program.
It's like Councilmember Johnson and Chief Lamont work together, Chief Daniels work together all the time. All right, with that, I would like to call for a vote. Please raise your hand or say aye if you are in favor.
Aye.
Aye.
2, 3, 4, 5. And any abstentions? Any opposed? Great, thank you so much, everyone. I'm really excited about this.
Thank
I'm
you
gonna-
very much.
Thank you, Lamont.
Thank
I'm
you.
gonna-
I appreciate it.
Thank you, Chief. I'm going to quickly move on to the second one, which is also under the police department. It's 2A and 2B. 2A, authorize the mayor, Harry W. Rilling, to execute any and all documents necessary to apply for and accept funding under the State of Connecticut Department of Transportation fiscal year 2022 Highway Safety Project DRE Instructor Support Grant. And 2B is authorize the Chief of Police, Thomas Kowalik, to execute any and all agreements, documents, instruments, and amendments as may be necessary to implement the State of Connecticut Department of Transportation fiscal year 2022 Highway Safety Project DRE Instructor Support Grant account TBD. I would like to turn it over to Deputy Chief Zecca to speak to this. Oh, I'm sorry. Can I have a motion to move it forward? Thank you, Councilmember Johnson. I'd like to turn it over to Deputy Chief Zecca to speak about this grant that they would like to apply for briefly.
Yeah, so one of our officers was recently trained as a drug recognition expert. That's what DRE stands for. And he was trained as an instructor, and part of that is then obviously training our officers as well as helping around the state to train other officers. So this is a grant that is provided by the state to help with funding some of those activities. So we're really at the kind of the tail end of this grant, but we figured it made sense to try to take advantage or try to leverage that for the last few months of the grant to help us with those activities. There is no cost share to the grant, so it will help for him to go. All of our newer officers are required to receive this ARIDE training, and they do not get that training in the academy. So there's a considerable amount of officers that will need to get trained as we move along. So that will help with those classes.
I think this sounds great, and I'm glad that you guys are once again being proactive about going after grant money for this. Does anybody have any questions or comments? Yes, Councilmember Johnson.
Thank you. Just a brief one. And thank you, Deputy Chief Zecca. I imagine this is going to be something that will really help us, especially because I've seen in the documentation about the increase of DUIs, especially with marijuana. So I'm imagining this is going to be really helpful for you all.
What it really helps with, what the training helps with, is to recognize those drivers that are under the influence of drugs, right? Everybody already is well versed in recognizing alcohol related, but the drug intoxication is a little more difficult to prove. So this will go a long way to bringing us up there.
Fantastic. Thank you.
Councilmember Revelous.
It's just going to be a headbutt of what you just said, because I do appreciate this, but it's part of why I asked my question prior to, because recently there was a time we were having a big influx of angel dust. So that, not just on marijuana, but this is part of that whole, I just want you to speak to it. I know it's a part of it. I'm just trying to get to it, like, to be spoken, if that makes sense. You know what I mean? That drug awareness of how to identify that, because that was actually a big issue for a little bit here. So just giving a space and place for it to be spoken, if that makes sense.
So,
You know what I
the training basically is about being able to show that someone is under the influence and is impaired under the influence of drugs. And that's what this helps to detect, and then to prove that case, to take drivers off the road that are operating under the influence.
And I appreciate that. Just wanted it to be spoken to. Thank you. This is great.
Are there any further questions on this item? Then I would like to call for a vote. All of those in favor, please raise your hand or say aye.
Aye.
All right, that's unanimous. Thank you so much. The next item is under the fire department. It's number 1, authorize Mayor Harry W. Rilling to sign mutual benefit and use agreement forms to utilize the following state of Connecticut contracts as needed in the event of large-scale disaster responses that provide the opportunity for FEMA reimbursement. Disaster debris response and management services, vendor Ashbrit, state of Connecticut contract number as noted. Disaster debris monitoring services, vendor is Tetra Tech, state of Connecticut contract number as noted. Can somebody move this item, please? Councilmember Ayers, thank you very much. And we have Michelle DeLuca here from the emergency management team to speak to this item. So Michelle, I'll turn it over to you.
Great, thank you. So about 2 weeks ago, I attended a state-sponsored training on debris management. And part of the conversation was really looking at what we have in place as municipalities, and then also what our backup plans are. So when you look at post-storm cleanup, there's one issue of debris cleanup and removal, and then debris monitoring, which is really, again, weighing, making sure everything's going in the right categories, cleanup, and then all the accounting piece. So in speaking to Public Works afterwards, they have some backup vendors for debris cleanup, not so much, again, on the monitoring side. Again, we've done it in the past as a municipality, but we know that there's always a potential for a really significant storm, another Sandy level or worse. So this really just uses the existing state contracts, or piggybacks off the existing state contracts. So if needed, we can use them if something exceeds our local capabilities for either one of these two services. We can activate both contracts if needed, or one or the other. And like I said, it really is just that standby mechanism. So again, should something happen, we know we have the resources. To some degree, we could do it kind of like post-event, so really in crisis mode or emergency mode. But as much as possible, it does make sense to try to do it now. This way we have the communication with the vendors and a little bit more of a relationship. So should we need them, again, we would be really considered an existing contract versus a new one. So it's just a benefit, and really it's just for planning purposes to make sure that we know, again, we have a little bit of a backup plan for both debris removal and debris monitoring. Hopefully it'll never be needed, but always good to have in place.
I just want to say thank you again. I feel like a broken record tonight, but thank you for being proactive with this and having this in place in the emergency or in the instance that we would have to call upon them. One of the questions that came up from my colleagues that's not on this committee that I wanted to just pose publicly was, do we pay for any of these services before we actually use them?
Correct. And we do not. So all we're looking at is signing a similar to almost like a mutual aid form. So it's just that agreement. Again, we're not paying anything up front. And you really would look at the prices and then also what services we would need. Because again, it really can vary during a disaster. And really look at that breakdown as needed.
Great. Councilmember Ayers?
Michelle, and I need to preface this by saying my master's concentration was in emergency management. So I think I'm overthinking. This is separate from mutual aid. So this is a third party contract, an independent contract. This is not like a mutual aid contract.
Correct. So mutual aid would be us working with the town of Westport.
Yes. So this, outside of that.
Yep. So this is piggybacking off the state of Connecticut's contract with Ashbrook and Tetra Tech. So what the state has done is, again, they have a contract or two contracts in place for these services on state property, state roads. And what they've now done is really extended it to the municipalities that we can use that same contract at the local level. Some towns will do their own contracting with different vendors and go through the whole RFP process. But like I said, it really does make sense since, again, we really have not had to ever use this and quite, again, knock on wood, and won't, it's just, again, a little bit more of the redundancy.
Okay, and since we are not going through the RFP process, is this particular vendor, I understand that this is the vendor that the state is using, but have we vetted them at any way? Has any other people complained about the services they receive? Have we done any of that type of legwork?
Well, both Ashbrook and Tetra Tech are really leaders in the field. Again, they are well-known, and really, again, when you start talking about debris removal, and I know this sounds like I'm a geek, but again, those really are the go-to, especially Ashbrook is really one of the big go-to names in debris. So again, they are well-known. They've been around for many years. And like I said, they really are probably one of the leaders in this field. And same thing with Tetra Tech.
Michelle, I'm glad you're a geek in this area because I am certainly not. Councilmember Johnson.
Yes, thank you, Michelle, for your expertise, because that means we're safer. I appreciate that so much. Just to be clear, I think it's again, so wonderful for the being proactive. From what I'm remembering with Superstorm Sandy, this was unfortunately necessary. Like, we needed more hands on deck than perhaps the city had in order to clear debris more quickly. This would enable, I don't know if that's fair to say, but this would prevent a situation where we were stuck, let's say, with trees still down on the road and DPW not able to get to the work they need to do. Is that fair to say?
Yep. So again, and this, any kind of activation of this, either of these contracts would be in partnership with the mayor's office,
Right.
and Public Works and Operations. Again, we know, and we've seen a lot historically, that a municipality could get hit with back-to-back storms. So in that case, maybe Public Works is dealing with Storm A, and then we get hammered with another storm. So again, resources may be stretched. So I think, again, it really is just that backup. So again, if it's bigger than anything we've ever experienced, we know, again, we can pull in some additional resources, or again, if we have concurrent storms and again, resources are just kind of tapped out, then bringing in some other assistance to help is always useful.
Thank you. Yeah, this is not outsourcing. This is just, it sounds also really fabulous that that is what it's not outsourcing, it's additional support, right? And then,
yeah,
perfect. And then the FEMA reimbursement, the 100% FEMA reimbursement is also something I noted from the backup that is a fantastic thing that we're already set into the relationships we would need to make sure that would be as easy as possible for you. So I appreciate that.
And a lot of times, especially with, so for example, it's Superstorm Sandy, we know that we had that presidential declaration before the storm even hit. So again, looking at a disaster like that, where you know going into it that those costs would be covered, that's, I think, again, would make sense for when we might activate a contract like this versus Ida, or you say is Ida, I believe, where we actually had to do a lot of documentation in order to get that presidential declaration after the fact. So again, knocking on doors and kind of going back through records of, you know, how much debris was removed, and just the overall damage assessments, looking at those events that really are kind of pre-declared. It's where, you know, again, the FEMA is going to be there. So there's not any kind of question. And then a lot of times, again, FEMA will often say, you know, for a 48-hour, 72-hour period, 100% of costs may be covered. And then it drops down to that normal 75-25 split. So I think, again, those are all factors we would look at before activating either Ashbridge or Tetra Tech to provide assistance.
Great. Thank you so much, Michelle. Are there any other questions on this item? All right, I would like to call for a vote. All those in favor, please raise your hand or say aye. It is unanimous. Thank you so much. And I am so happy to report that we are done in record time. Thank you so much, everyone. I appreciate everyone being here. And
Diana, do your thing.
Motion to adjourn.
motion to adjourn, please raise your hand. All those in favor.
Aye.
Thank you so much, everybody. See you in a little bit, either on screen or in person. Take care.
Night.
Thank you.
Yeah.
Bye.
Bye.
Have a good night.
Good night.